You talked about a little bit about diet
Yeah.
playing a major role. What is the fact that people should do, and what is the fiction out there in terms of diet that they should not do?
Okay, so one fact which was definitely there specifically in India was vitamin A deficiency. Okay, that you might have heard keratomalacia, etc. The cornea, the conjunctiva became lusterless and the cornea would melt and they would be exposed to infections. But fortunately, vitamin A deficiency has gone down significantly. Trachoma was another disease which has been controlled significantly. So the good things that are required for the eye are typically vitamin A. So that you have in this thing, vitamin D has an important role, and apart from that, you have the omega-3 fatty acids, etc., which you look at from the older age point of view for the ARMD. So green leafy vegetables are definitely good, and you have carrots and radishes, you have poppy or somebody
Right,
eating this
spinach.
thing. So basically, yes, it does help in the lubrication of the eye, the secretion of the tears, etc., and overall health of the eye, which is there. So these are actually good foods. Bad foods are also something which is important. So smoking is very bad for the eye per se because it can lead to optic nerve damage. It can lead to retinal problem, diabetic retinopathy, etc. Blood pressure, lipids being bad, diabetes, etc. These are again things which one has to take care of for the
Should
general
control.
health of the eye.
Any fiction that you wish that the patient change? They'll come with so much amount of confidence that this definitely works for eye health.
Oh no, they feel that if they take one gajar a day, they won't need anything. But that's something which can at least best be a supplement. But that's about it. I think the eye health has to be taken care of, and you have to kind of get your eyes examined, and if need be, you have to get the corrective power, etc. done.
So once a year examination for adults
Yes.
also.
Yes. Another thing which we didn't mention about when we looked at from the computer vision syndrome or this thing is dryness.
Dry eyes.
So there are two big things which have happened because of what we are doing nowadays. One is if you talk about Delhi nowadays, there's an AQI which we had never heard when we were kids. So you have so much of pollution and all. So these both the organic materials, etc., the pollutants, the PMI, what is called as the particulate matter, etc., they break the tear films. Okay, and the tear breakup time gets altered, and a lot of dry eye and allergies. We only talk about asthma and all, but the eye is also exposed to the environment. So the eye also gets a lot of dry eye problems and allergies because of the environment in which there is so much of pollution. And the partial blinking and the strain that you have on the screen, that also causes dry eye. So these are dry eye is also something that is galloping, I would say,
Significantly.
significantly.
And the patient present usually with watery eyes, right?
It's basically a reflex tearing. It's a kind of a converse. If you look at a mind, we are talking about dry eye and then you're talking about watery. So actually, it's a reflex tearing because in Hindi we can say khurdarapan. That means that the lubrication is gone. So when the lid is moving over the eye, since it's not well lubricated, like when you look at the joints, if your fluid is less, so basically you tend to have like arthritis or you have problems there. So similarly, this causes reflex tearing. So initially, yes, there would be irritation, there will be redness, there will be watery, there will be scratchy eyes. That is what it is. And then it becomes more and more acute. You could have problems in the conjunctiva and finally in the cornea.
I've seen many people having watery discharge and then
Yes.
they just wipe it off and then just keep going. When should they come and see an eye doctor?
No, ideally, as you said, we have to see
Once a
every
year.
hourly, but every year. But what is important is that if at any time you feel that there is a lot of watery and there is at any indication of any purulent discharge, purulent means pus, jisko bolte hain, that means that it's not just watery, but it's having a mucoid kind of a discharge. And the second thing is that in case at any particular time your vision seems to be getting affected. And you become intolerant to light, which is in medical terms called photophobia. That means photo means light, phobia means you're not able to open the eyes. So those are the indications that you need to come. Persistent redness in the eye. Those are the things. If that happens, then you need to definitely come.
And there's another question about buying lubrication drops over the counter.
No harm. It's an over-the-counter drops, but unfortunately, in India, everything is over the counter. So lubricant eye drops across the globe are OTC products. And there is no harm in putting lubricant eye drops 2 to 3 times a day because they are just like artificial tears. So they tend to be as near to the what your tear solution is per se. So that is not a problem. But taking any medicine like a steroid or a steroid antibiotic, etc., just to say that if you're buying a steroid, which you should never do and you should never self-use, there is a red line on that bottle or on the pack. So that is like danger. So that please don't do over the counter, but lubricant eye drops, there's no problem.
Oh, so you're saying that a drop has a red line?
Drop, not the drop. The
bottle.
Bottle or the package.
The bottle having a red circle indicates that it is maybe a steroid.
Yeah.
Oh, that's good to know. Okay. So that shouldn't come without a doctor's prescription.
It shouldn't. Even overuse of antibiotics nowadays, that's vets, there's a lot of antibiotics that are being used and left, right and center. So that is
topical
causing...
on the...
No.
Oral as well?
So basically, most of the orals are also used as topical. It's just the same. Like, for example, if you have ciprofloxacin, you can have oral, you can have topical drops, etc., etc. Erythromycin, you can have. So those are things which are chloramphenicol, etc. So these are basically the same. It's not a new specific antibiotic that is developed for the eye. So there is a cross sensitivity that is happening.
Got it.
So the resistance is developing.
For a person listening to this podcast, they can say lubricant drops is completely okay to buy.
Yes.
And if
Nothing
it is
else.
an antibiotic, nothing else. Okay, nothing else.
Antibiotics, yes, you could, but not... basically, if there is an indication, that's what I was trying to say, that there is an overuse of antibiotics that is happening.
Correct.
So that is causing, in the long term, you have to keep on developing new antibiotics which don't develop that early. It takes years and years to develop a new set of antibiotics, etc. So if you are developing a resistance to the antibiotics, whether it be oral or whether it be topical, etc., that's going to be a problem later.
Follow Center for Sight and post your queries to get answers from the experts.